by Eisenhower Medical Center.
Welcome back. Dr. Hazmer Cassim is with the Eisenhower Health Group. Thank you for joining us. Now, we want to talk about pain management today.
Yes.
I think the first thing to understand is what distinguishes something like regular or acute pain from chronic pain.
Exactly. Well, thank you, Angela, for having me here today. Acute pain is a condition that has a definitive beginning, middle, and end. So typically if somebody experiences that acute pain, within 3 months to 6 months, there's improvement, it gets better, and life moves on. Chronic pain, on the other hand, is a condition that lasts a lot longer without any definitive ending. And during that time, there are certain changes that take place in a cellular level. We call it hyperalgesia, wind up, a lot of different medical names for it. But essentially what happens is that it becomes a very challenging and difficult condition to treat.
Right. And at that point, you might want to think about seeing someone, right?
Exactly. So if pain is affecting quality of life, function, if it's limiting things people like to do like golf, tennis, and they've tried simple things like physical therapy, home exercises, then it's time to consult a pain management specialist who can help.
What are some of the things you've seen that have led to some chronic pain in your patients that you've seen?
Sure. So there are a lot of different reasons people come to see us as a pain management specialty. Radiculopathy or sciatica, which is pain in the back that radiates down the leg. It's a common one. Arthritis in the neck and low back as well.
Yeah, I feel like that's from bending over, maybe typing or working?
Absolutely. Any type of activity can cause these types of syndromes. Specifically here in the desert, we have a very active population. Golfers, tennis players, pickleball is getting popular too. And with all these different sporting activities, there's a higher risk for disc herniations and spine-related injuries that are challenging to treat.
I was going to say, the spine with golf, because you're twisting a lot. And
absolutely.
So, okay.
And our goal, though, is to have people function and still do the things they like to do, but make sure that they can do it with limited pain or no pain.
Absolutely. Now, you have a lecture coming up. Do you want to talk a little bit about that?
Sure. So, our pain group consists of a few talented physicians, Jeff Smith, Kevin Wong, myself, and we are talking about chronic pain syndrome. And chronic pain, essentially a multidisciplinary approach to manage pain. So when people get into this chronic pain phase, you need a team approach to help them, where they use all different types of specialties, including therapy, behavior modification, precision-guided treatments like epidurals or ablations, together in a comprehensive treatment plan to help. And that really is the focus of our treatment at the Eisenhower Desert Orthopedic Center.
If someone wants to go and hear that lecture?
Yes, the information should be popping up right now. It's at the Annenberg Health Science Building, 4 to 5, and we should be able to give you some good information.
Absolutely, and you do have to RSVP. You can't just show up, or can you?
You can RSVP, but you can show up too. We're always open and welcoming.
Always open. Wonderful. Well, very important. I know chronic pain affects more than 20% of Americans. Thank you so much for coming on and talking with us.
My pleasure. Thank you for having me.
More top stories after the break. You're watching News Channel 3.
The Paul